all three of our major medical centers, Christus Spohn Health System, Corpus Christi Medical Center, and Driscoll Children's Hospital came together with United Way to conduct a community-wide health needs assessment for 22 counties. So today you will get to hear how that was conducted, some of the findings, and some of the projects that we're looking towards in actually achieving change in the areas where it was most identified within that assessment. So I'm very...
in 2010, as Katrina said, Christus Spohn, Driscoll Children's Hospital, Corpus Christi Medical Center commissioned Texas A&M, Corpus Christi Social Science Research Center to conduct a health needs assessment for our coastal Bend counties. A community health needs assessment is conducted every 3 years. Organizations such as the United Way of the Coastal Bend, Driscoll Children's Health Plan, and the Nueces County Medical Center Society, all contributed to the study. The 2010 Community Needs Assessment gathered data from 4 sources: a telephone survey of over 500 respondents, 9 focus groups in 5 different areas: Alice, Corpus Christi, Kingsville, Senton, and Aransas Pass, an online survey of healthcare and social services providers, as well as an analysis of over 440,000 inpatient visits to coastal Bend hospitals over a 2-year period. The needs assessment identified the following, some of which are not going to be surprises to us. Segments of the coastal Bend population have limited access to health care. Some hospitalizations are preventable. Mental health admissions are increasing. Obesity is a major problem in our community. There are urban and rural differences in perceptions of healthcare access and conditions. Chronic conditions such as cancer, hypertension, diabetes are prevalent in the coastal Bend. Medical specialists are needed in our region. Disparate perceptions of issues among healthcare and social service providers and our community at large. And then, of course, the most key, continued cooperation among healthcare providers is important. After careful consideration of the findings, the task force decided to take 3 key initiatives. Increase public awareness of the healthcare resources available in the coastal Bend. Reduce preventable hospitalizations in areas such as pneumonia, urinary tract infections, and dehydration. And then finally, increase access to specialty health care for residents who live in the rural coastal Bend areas.
We have here a display, and I'd like to say, in working with Pam Robertson, the President and CEO of Christus Spohn Health System, and Ed Lamb, the CEO of Corpus Christi Medical Center, it's been delightful to sit down with these professionals and see how all of us care first and foremost about our patients. And this entire effort is carved out by the desire to make things better for the patients in this 22 county area. The Coastal Bend Health Finder is a collaboration of 70 healthcare providers across the entire area. You can go to one site, access each one of their websites and information about their webs. For somebody that has no access to care, just doesn't know where to go, this is a perfect place to find a physician, to find a special needs health situation, dialysis, durable medical. Most of us just don't know, and so this is a broad-based education, service, and opportunity that we wanted to sponsor so you could find out. Easy to access. When I walked in, I accessed it myself, and it's a beautiful website. And I just have to thank not just the CEOs and president, but the entire group of staff. You saw collaboration at all levels of our staffs to bring this to you. So I just have to thank you.
It's wonderful to be here with you today. I want to thank Katrina and my fellow CEOs who are here from our hospital systems. Pam and Steve. It's a wonderful thing for us to be able to get together. I think you've already heard that. Plus, it's nice to have a couple of roses amongst the thorns here. And today is really special from the standpoint of not only do we get to roll out the results of what we've seen with regard to the study, but to also tell you a little bit about one of the very significant programs that we feel is impactful in our community. As you could tell from what Pam described in her presentation, there are many things that we could really focus on, but we've chosen one, and that has to do with pneumococcal diseases. Pneumococcal diseases would include pneumonia. That would also include meningitis. It would also include bacteremia, which are bloodborne diseases. And the reason that we have chosen that is because it really focuses in on a specific population that we have seen an increase in those diseases. And that would be people in the ages of between 50, I'll look at mine too, Steve, the 65 and 70 folks. We know from research and from recommendations from the CDC that as an adult, by the time you are 50 years old or at 50 years old, you should receive your first immunization for pneumococcal diseases. And we feel that it's very important to get out in front of that here in our community and be able to provide those kinds of vaccinations for people who are at risk, people who don't have the resources, people who need to be able to get those immunizations. Seniors age 65 through 79 have double the risk of folks younger than that if they don't get that vaccination. Or if they get pneumonia, they have a significantly higher morbidity than other people would if they had not had that vaccination. Chronic heart disease or folks with chronic heart disease and folks with COPD are also at risk. So you can see that there are compounding things that are comorbid conditions that people have that if they don't have that vaccination can really have prolonged stays in hospitals and can even have death as a result of that. So we're very pleased and very proud to announce today that we have funded through this project free immunizations that will begin being distributed on 3 different dates, and that will be September the 10th, October the 8th, and December the 10th. And those will be distributed with our partners, HEB. We're very grateful to be able to have them as folks that are working with us. The HEB pharmacies, and then also at our affiliated hospitals within the collaborative. Now these dates are going to be subject to change based on how many people we see coming in and receiving those vaccinations. People have asked, well, how many are you going to be able to give? We're going to be able to give as many as we have the funding for. And right now we're projecting between 400 and 500 vaccinations at this point. So again, thank you very much. We want to express particularly appreciation to our friends at United Way for working with us, certainly for the hospital systems and being able to come together and being able to look at this as a project together. And we want to thank our friends at Texas A&M who really went to work on putting this project together for us and doing the assessment. We're very proud of that and very proud of what they have done. And certainly all that will be involved in helping us to distribute these vaccinations. So thank you again, thank you for being here with us, and we look forward to having great success as we move forward.
So I hope you're very excited about what you heard today. There are going to be some great changes coming about in the health needs and how they're addressed in our community because of the work of these wonderful organizations.